Compliance and ethics training. Medicare is the federal program that provides medical care insurance to those who are 65 and retired or otherwise disabled and unable to work. This very complicated program has a high potential for fraud and abuse. Without compliance with federal laws for Medicare, you and your organization can encounter legal troubles. Medicaid is a state program that provides health coverage for lower-income people, families and children, the elderly, and people with disabilities. Medicaid fraud is a serious offense. If you work in a healthcare provider's office, a hospital or residential facility, a medical supply store, sales for medical devices or pharmaceuticals, you need to know and understand the U.S. compliance laws. Compliance applies to management, physicians, professional staff and employees, contracted consultants, and other agents. Individuals working in risk areas and specific employee groups, such as company officers, should receive specialized training in topics related to their responsibilities. Compliance and ethics training for healthcare professionals will soon be mandatory. The days of voluntary compliance is quickly moving to a close. The Patient Protection and Affordable Care Act, PPACA, enacted on March 23, 2010, mandates that entities enrolled in Medicare and Medicaid programs have a healthcare compliance and ethics plan in place by March 2013. Section 6401 of the PPACA and the Centers for Medicare and Medicaid Services, CMS, Section 42, CFR 422.503, specifies that healthcare entities must establish a compliance program that contains effective training and education as a condition of enrollment in government programs. Compliance training helps to ensure HC employees conduct business in compliance with all applicable federal and state laws, rules, and regulations, perform services and bill for them in an ethical and legal manner, and prevent, detect, and report fraud. Effective compliance training and education. Pleading ignorance will not minimize the penalties. Navigating the fraud and abuse laws. Healthcare services are governed by complex statutes and fraud and abuse laws, such as False Claims Act, Anti-Kickback Statute, Stark Law, Mail and Wire Fraud Statutes. False Claims Act. Overview. Prohibits the submission of false or fraudulent claims, billing, to the government, Medicare and Medicaid programs, including filing claims for services not provided or not provided as described in the claim, submitting claims for equipment or supplies and services that are not reasonable and necessary, double billing resulting in duplicate payments, failure to properly code using coding modifiers, or otherwise submitting false data to a state or federal healthcare program on which reimbursement is based. Examples: chiropractor, intentionally billing Medicare for physical therapy and chiropractic treatments that were never actually rendered for the purpose of fraudulently obtaining Medicare payments. Physician, instructing his employees to tell the Office of Inspector General, OIG, investigators that the physician personally performs all treatments, when in fact, medical technicians do the majority of the treatment and the physician is rarely present in the office. Home health, submitting claims for home health aid services to beneficiaries that did not require any skilled qualifying service. Conducting more visits than medically necessary or duplicate billing. Hospice, providing nursing services for non-hospice patients. Hospital, improper billing for observation services, failing to follow the same-day rule, abuse of partial hospitalization payments, same-day discharges and readmissions, billing on an outpatient basis for inpatient-only procedures. Durable medical equipment, DME, provider, Billing for items or services not provided to the beneficiary. Continued billing for rental items after they are no longer medically necessary. Resubmission of denied claims with different information in an attempt to be improperly reimbursed. Providing and/or billing for substantially excessive amounts of DME items or supplies. Providing a wheelchair and billing for the individual parts, unbundling. Knowingly misuses a supplier number, which results in improper billing. Summary. Accurate billing and coding are critical. Whistleblower protection. The Federal False Claims Act contains important protections for whistleblowers. Persons who in good faith report fraud and consequently suffer discrimination are entitled to all relief necessary to be made whole, including 2 times their back pay plus interest, reinstatement at the seniority level they would have had except for the discrimination. This also includes compensation for any costs or damages that they may have incurred. Anti-kickback statute. Overview. Provides criminal penalties for individuals/entities that knowingly and willfully offer, pay, solicit, or receive anything of value to induce or reward referrals/business payable or reimbursable under the Medicare or other federal health care programs. The main purpose of the statute is to protect patients and the federal health care programs from fraud and abuse by curtailing the corrupting influence of money on health care decisions. Examples. Illegal remuneration schemes. Provider is offered/paid unlawful compensation to reward or induce the provider to write prescriptions for drugs, products, or services. Physician, who is under investigation by the FBI and CMS, offers services in exchange for altering records in an attempt to cover up billing improprieties. DME provider issues cover letters to encourage physicians to order medically unnecessary items or services. Pharmacy benefit manager receives unlawful remuneration in order to steer a beneficiary toward a certain plan or drug, or for formulary placement. Includes payments from vendors beyond switching fees. Illegal remuneration schemes. Continued. Ambulance provider offers free transportation to patients to influence their selection of a particular provider or supplier. Script mills. Provider writes prescriptions for drugs that are not medically necessary, are often in mass quantities, and often for patients that are not his. This might include improper payments to the provider. Theft of provider's DEA number or prescription pad. Prescription pads and/or DEA numbers can be stolen from prescribers. This information could illegally be used to write prescriptions for controlled substances or other medications which are often sold on the black market. Pharmacy. Substitution and kickbacks. Giving a recipient a generic drug, but billing Medicaid for the brand name version. Bait and switch pricing. Bait and switch pricing occurs when a beneficiary is led to believe that a drug will cost one price, but at the point of sale, the beneficiary is charged a higher amount. Prescription drug shorting. Pharmacist provides less than the prescribed quantity and intentionally does not inform the patient or make arrangements to provide the balance, but bills for the fully prescribed amount. Expired drugs or tainted drugs. Dispensing drugs that are expired or have not been stored or handled in accordance with the manufacturer and FDA requirements. Broker fraud. Marketing practices. Offering beneficiaries a cash payment as an inducement to enroll in Part D. Conducting unsolicited door-to-door marketing. Enrolling beneficiaries without their knowledge or consent. Stating that a marketing agent/broker works for or is contracted with the Social Security Administration or CMS. Misrepresenting the product being marketed as an approved Part D plan when it actually is a Medigap policy or non-Medicare drug plan. Requiring beneficiaries to pay upfront premiums. Physician self-referral law. Stark Law. Overview. Limits physician referrals for Medicare and Medicaid patients when there is a financial relationship with the entity. Physician self-referral is the practice of a physician referring a patient to a medical facility for designated health services, DHS, in which the physician has a financial interest, i.e., ownership, investment, or a structured compensation arrangement. There are 18 current exceptions to the Stark Law, e.g., referring patients to other physicians in the group for in-office ancillary services. Designated health services. DHS covered by the Stark Law include clinical laboratory services, physical therapy, occupational therapy, and speech-language pathology services, radiology and certain other imaging services, radiation therapy services and supplies, and nuclear medicine, durable medical equipment and supplies, parenteral and enteral nutrients, equipment, and supplies, prosthetics, orthotics, and prosthetic devices and supplies, home health services, outpatient prescription drugs, inpatient and outpatient hospital services. Mail and wire fraud statutes. Mail and wire fraud statutes make it illegal to use the U.S. mail or electronic communication as part of a fraud. The government can prosecute mail fraud by proving that a person devised or intended to devise a scheme to defraud and use the mail or a private or interstate commercial carrier for the purpose of executing or attempting to execute the scheme. For example, these statutes make it illegal to mail a fraudulent bill to Medicare. Perils of noncompliance. U.S. federal sentencing guidelines impose harsh penalties upon organizations whose employees or other agents have committed federal crimes. Indictment/convictions can result in non-payment for services, exclusion from Medicare and Medicaid programs, civil monetary penalties, prison time. Federal exclusion. OIG has the authority to exclude individuals or organizations from participating in Medicare, Medicaid, and other federal programs. Medicare Advantage organizations, Part D sponsors, and contracted entities are required to check the OIG and General Services Administration, GSA, exclusions list for all new providers, and at least one time a year thereafter to validate that employees and other entities that assist in the administration or delivery of services to Medicare beneficiaries are not included on such lists. OIG List of Excluded Individuals/Entities, LEIE. http://exclusions.oig.hhs.gov/search.html. GSA Database of Excluded Individuals/Entities. http://epls.arnet.gov/. Civil and criminal penalties. False Claims Act. Civil penalties. Violations may result in civil monetary penalties ranging from $5,000 to $11,000 for each violation. If the government proves it suffered a loss, the provider is liable for 3 times the loss. Criminal penalties. Courts can impose criminal penalties against individuals and organizations for willful violations. Anti-kickback statute. Civil penalties. Violations may result in civil monetary penalties of up to $50,000 for each violation of the statute, plus damages of up to 3 times the total amount of the unlawful remuneration. Criminal penalties. Violation is a felony. Fine of up to $25,000 and/or prison for up to 5 years. Exclusion. Violation may result in exclusion from participation in the Medicare and Medicaid programs. Make compliance a priority now. Know the fraud and abuse risk areas. Just because a competitor is doing something doesn't mean you can or should. Call 1-800-HHS-TIPS to report suspect practices.